on how to do it and what's causing it. We're going to make you read a little bit today. Okay? Let's go to the next test. What's the next test?
Horizontal abduction.
We're going to definitely read how to do this.
Okay.
And then we're going to read what's causing it. Jen's going to help us. And Jen will tell you where she's at in the manual. Where are you at, Jen?
Page 41.
And you're going to listen. Okay? On page 41, this is called the horizontal abduction test. Jen, go ahead and read it.
Patient lies in supine with knees flexed to flatten the lumbar spine. Passively take the patient's arm into horizontal abduction while securing the shoulder joint with one hand and maintaining forearm supination with the other hand. A positive test is indicated by limited horizontal abduction of one extremity when compared to the others.
Okay.
Less than 30 is considered limited. Now, if you flip to page 42, the first two paragraphs underneath BC test reasoning, I will read that now. Thoracic rotation to the right is needed to fully realize left shoulder horizontal abduction, and likewise left shoulder horizontal abduction indicates the presence of right thoracic rotation. With the typical right BC pattern, the lumbar spine is either oriented toward the right with the right thorax rotated back to the left, or the lumbar spine could be positioned neutrally with the thorax rotated back to the left. In either case, the left arm will be limited into horizontal abduction because the right BC overactivity is directing the thorax to the left and preventing it from rotating back to the right. Limited shoulder horizontal abduction on the left is a direct reflection of the patient's inability to rotate their thorax back to the right on a lumbar spine that is either oriented to the left or positioned neutrally.
That last sentence, she's reading it fairly fast. You will need to read it a few times. But what she's saying is this limitation could be influenced by the position the lumbar spine is in or by the position the lumbar spine is not in. The lumbar spine may be neutral, but the lumbar spine might also be oriented to the right. So it could be on either case. You could be limited. So I just want to make sure everybody understood that.
You're either a left AIC with a right BC, or
Yes.
you're just a right BC.
I couldn't have said it better. I was just about ready to say exactly that. Repeat it again, Jen.
You're
You
either a left AIC with a right BC, or you're neutral at the pelvis and just a right BC.
Okay. Pretty objective test. Is there anything else on horizontal abduction?
In the absence of anterior shoulder joint or anterior chest wall pathology, a negative test is seen when one extremity displays near full and equal range into horizontal abduction when compared to the other. This means the pectoralis major is inhibited and the ribs are in a position to allow the torso to fully rotate in the opposite direction. When both extremities display near full and equal range into horizontal abduction, it means the torso is allowed to fully rotate in both directions.
Isn't that cool, Chad? When we know there's horizontal abduction on both sides, we probably do not have a problem with rotation. We could still probably have a problem with most posterior mediastinum. In other words, the pecs are not a problem. Chest is forgiving. Remember that bing thing going on, or the split? In other words, those pec muscles are not pulling into a split and deepening your sternum sulcus. But we could have some posterior mediastinal issues, which is coming up. But so that's horizontal abduction. It's a fairly significant test. So on him, if I ask him to slide over to the right side, and I take his arm and I gently secure the arm, and I try to extend the elbow. There we go. And I guide him down in slight supination. I guide him, and he's breathing. And I'm so, Tessa, I'm doing this for you because I just think it's so cool you're here. My palm is on, I put my palm right below, there's this collarbone, and I'm going below the collarbone, and I'm just that kind of a guy. I'm just intuitively wanting to know what those ribs are doing. I'm not interested in a shoulder. A lot of people are so interested in shoulders. I'm not one of them. And I love shoulders. But I'm interested in this rib cage. So automatically, can you tell Jonathan, where do I have my hand?
My ribs?
On his ribs. I can feel the shoulder just fine. I want to feel if those ribs are moving away from that shoulder. Keep breathing. And they are. Right away, Tess, I feel good about this guy today. Now, what if he was breathing and there was no movement between those ribs and that shoulder? I know he's got a brachial chain. But he's doing great today. So I know that I'm probably going to get a good 30 to 45 degrees of horizontal abduction. Now let's flip them around and put them over here. Now I'm going to go on the other side. And I'm going to put my hand in the same position I had it on the other side. I'm on the rib cage. I'm going to go in slight supination. And I'll do all the work. Okay? Scoot over here towards me a little bit. Okay, I'll do all the work. Jonathan, thank you. And I'm going to guide him down. Wow. Looks awesome. Full horizontal abduction. All right. Great demo on a person who's, at this point, looks pretty what? Neutral. I'm going to mess him up here in a minute, but let's just keep going. Okay, let's go ahead and slide back to the middle. Jan, what's the next test?
Humeral glenoid internal rotation. Patient lies in supine with knees flexed to flatten the lumbar spine.
Sure? Okay.
Position the patient's bent arm at shoulder level. Stabilize the shoulder by placing firm pressure on the anterior shoulder joint. Passively rotate the patient's arm toward the mat as far as it will go. Repeat the test on the opposite extremity. A positive test is indicated when the patient's arm will not fully rotate towards the mat or table.
Okay. And I just grabbed a towel because Joe's arm is a little high. So I'm going to, I'm sorry, Joe, you're now Joe. Jonathan's arm's a little high. So I'm going to put this towel here, scoot over that way, just to anatomically, Jan, get him lined up. And all I'm doing is just kind of lining him up in the socket. I could leave that towel out, but I'm going to put it there. If he's a skinny little guy, I wouldn't put it there. And again, I'm just trying to help you all. And all I'm going to do now is secure his shoulder pretty firmly. Secure it. But I'm going to let the ball, Tess, I'm going to let the ball, that humeral bone, roll inside my palm. I'm not going to push down on that ball and just limit his rotation. This would be limiting his rotation. Limit. This would not be limiting his rotation. Right, Jonathan? Right. There's a difference. It's called concavity-convexity rules. Slide and glide. Okay? Full internal rotation on this left side. He's going to flip around, put his head down over here. And we'll go through all three tests, and I'm going to show you, Rick, what happens when we take away a mediastinum. Okay? So I'm going to come on over here. I'm going to do the same thing over here. I'm going to, just for the demonstration purposes, I'm going to do the very same thing. I'll take the towel out over here. So he could be a little tighter, right, Jonathan?
Yeah, a little bit.
But I consider that pretty full. If I keep working with him a little bit and get the cuff stretched out, Linda, no problem. There's no restriction from glenoid position. There might be restriction from capsular stiffness. Did you hear what I just said? But there's no restriction from glenoid position, which is what this course is all about. What's the next test, Jen?
Hang on, I'm gonna
You're going to tell why. Oh, okay, that's right.
So on page 42, the BC reasoning, external rotation of rib 1 and 2 on the right positions the glenoid, scapula, in a slight upward rotated position about a sagittal axis. Limited right apical expansion positions the glenoid in an internally rotated position around the vertical axis. Winging or posterior backward movement of the vertebral border of the scapula. You can see this on appendix page 41. Actually, that might be the wrong page. Resulting in limited humeral internal rotation when the right humeral bone is positioned at 90 degrees from the lateral thorax in supine with the elbow on supporting surface. In this thoracic position, right HDIR is limited secondary to posterior superior humeral glenoid impingement because of the glenoid's passive horizontal adduction orientation on the thorax with respect to the humeral bone activity and humeral active rotation in the glenoid during humeral horizontal abduction.
And I listened to her in a I try to be an ignorant, unbiased individual. Right now I'm trying. I did not say ignorance in a negative way. I just try to understand. If I didn't understand anything, I believe everything she said was helpful for you to learn from. We have in your manual, she's looking for it, pictures. What page?
Page 53 of the appendix.
So
it's
change
showing
your
the
phone.
scapular rotation.
Yeah, so you can see what she just said and the impact it would have on your humeral function because of glenoid forward position. So that's in your manual. I think I've got some PowerPoint slides coming up. But nonetheless, at this point, we are using this test to help us with glenoid, which is scapula assessment, not humeral assessment. Okay? Is it okay if we go on to the next one? We'll just keep going? Yeah, Rick?
Would you have any concerns about gender-specific orientation of the glenoid?
You know, I probably should have concerns about, female, male, gender concerns, but we don't in this institute go that far. But obviously there is some variances that we should probably take into account. But for what we're doing right now, it's kind of like the all or none principle, Rick. If you're in a position, no matter even if you have the gender differences, you should still have significant, that's why we're being kind. 30 degrees of horizontal abduction, not 45. Almost complete IR, not full, whatever you want to do. The question is, when you're moving these extremities, remember, we're not interested in the extremity. We're interested in whether or not the glenoid is allowing it. And then to quantify that, it could change because of gender, because of occupation, and because of maybe even their genome, their heredity, the parents they chose. Go ahead, Jen. The next one is called shoulder flexion. Okay? Often not looked at. I don't usually test to look at this right away. But it's important to look at it and at least discuss it. So we're going to discuss it.
Patient lies in supine with knees flexed to flatten the lumbar spine. Passively take the patient's arm into flexion. A positive test is indicated by limited shoulder flexion of one extremity when compared to the other.
Okay. Pretty easy to do. Just take an arm up and you're comparing passive flexion to the other side's flexion. You're going to see more than likely limited flexion on the left side. Why? Why? Jen, I know you know the answer, but why? What does this mat do to this patient's thorax? It flattens out his trunk. But I didn't create, if he was a BC patient, I didn't create a hole for his right rib hump, did I? Which means is if he's a BC patient, which hemithorax would be forward? If he was a right BC patient, which hemithorax would be more forward? He's not today a right BC patient. If he was, I'm going to create one, but if he was, which hemithorax would be forward? The left. And if the left is forward, his flexion is going to be limited on the left side. He will not get that arm down. Now, if you put him on a mat and you gave him a hole for the right rib hump, he'd have full flexion on the left side. See, we went to programs that look at people on their back without ever considering what you need to do to the plinth to address the position the hemithoraxes are in. That make sense to everybody? I'm going to go ahead. Is there anything on shoulder flexion you want to read about? Okay. Before we get into cervical axial rotation at this point, I'm now going to create a person who cannot flex their left arm. Okay, because that's, Brianna, I got out of school, and I was told, you got to have flexion, full flexion. Okay, full flexion of that arm. I had 7 years of working with nothing but strokes and amputees. 7 years out of school. I was blessed. Thank you so much. I made 22 cents an hour, but I was blessed. Okay. 7 years of working with a four-letter word called tone. And I was amazed once I took this directorship of a